Good morning. This pandemic has had a huge impact on lives and livelihoods. We can see it in the lives we've lost, the Canadians out of work, the businesses that have closed, and long wait lists for surgeries. But some of the impacts of this pandemic are not visible at first glance. The frontline health heroes, those experiencing anxiety, burnout, and depression from working long hours and losing people in their care. Plusieurs effets et conséquences de cette pandémie ne sont pas visibles. Les héros de la santé en première ligne, ceux qui souffrent d'anxiété, d'épuisement professionnel et de dépression à force de travailler de longues heures et de la perte des patients. I think about our kids, including our daughter Molly and our son Jack and their friends. Millions of young Canadians have spent a year away from their teachers, coaches, their friends, their mentors, or they've faced major changes in their lives. School closures and the lack of sports and other activities had a massive impact. We see alarming increases in eating disorders and rates of anxiety in young people. Our seniors have been stuck in isolation and unable to visit their children or grandchildren. 1 in 5 Canadians suffers from symptoms of depression, anxiety, or operational stress. Someone you know is struggling right now. The mental health crisis is the epidemic within the COVID-19 pandemic. Un Canadien sur 5 souffre de dépression, d'anxiété ou de stress post-traumatique. Quelqu'un que vous connaissez souffre en ce moment. And we need Canadians to know we are taking action to support you and your loved ones. A Conservative government is prepared to make the historic investments needed and to work with the provinces to build better, more connected mental health care systems for all Canadians. Canada's Conservatives will deliver the help Canadians need with our Canada Mental Health Action Plan. Un gouvernement conservateur va investir au bon endroit. On va travailler avec les provinces pour créer des systèmes de soins en santé mentale plus efficaces et plus connectés pour les Canadiens. Avec le plan d'action canadien pour la santé mentale, les conservateurs vont agir pour aider les Canadiens. We will start by investing billions in public health care, increasing health transfers to the provinces by at least 6% per year. After coming through a pandemic, the Liberals decided a one-time top-up for health care was good enough. It isn't. As Prime Minister, I will double the current federal commitment to the growth of health funding, making an additional $60 billion available for health and mental health over the next 10 years. This will be the largest increase in federal health spending in a generation. It will reinforce and secure our public and universal health system. And it will enable the provinces to invest in mental health as the health care priority it is. Comme Premier ministre, je vais doubler l'engagement fédéral pour l'augmentation du financement de la santé. Au cours des 10 prochaines années, un gouvernement va donner 60 milliards de dollars additionnels pour la santé et la santé mentale. Ça va être la plus forte augmentation des investissements fédéraux pour la santé depuis des décennies. Et ça va permettre aux provinces d'investir dans la santé mentale. C'est une priorité. We won't bicker and fight with the provinces, but we will work with them as true partners on mental health with the goal of giving more Canadians access to the vital mental health treatment they need, and more quickly. And we'll ask corporate Canada to do its part too, offering them a big incentive to make mental health a priority for their employees. We will provide a 25% tax credit for 3 years to encourage companies to add mental health coverage for their employees. We know that nonprofits and charities are doing outstanding work every single day in supporting those facing mental health challenges, addiction, and desperation, like our friends here at Liberty for Youth. They are community heroes, and Conservatives will support your great work and help build capacity on the ground in communities across our country. We will provide $150 million over the next 3 years in grants to nonprofits and charities delivering mental health and wellness programming on the ground across Canada. Au cours des 3 prochaines années, on va offrir 150 millions de dollars aux organismes communautaires et à but non lucratif qui offrent des services en santé mentale. We also want access to crisis mental health support to be available to Canadians 24/7. That's why, similar to using 911 in case of emergency, Canada's Conservatives will implement a nationwide 3-digit suicide prevention hotline so that consistent help is available everywhere across the country. Finally, we know that Indigenous communities face particularly serious mental health challenges and often lack the support they need. The rates of suicide and mental health challenges in Indigenous communities far exceed those in non-Indigenous ones. Intergenerational trauma can lead to addiction and mental wellness issues. We must address this as a country. A Conservative government will ensure that culturally appropriate supports are there for Indigenous peoples when they need them most. We will invest $1 billion over 5 years to boost funding for Indigenous mental health and drug treatment programs, including building community capacity and delivering programs in Indigenous languages. This represents the single largest commitment to improving mental health for Indigenous communities in our country's history. As a country, we need to recognize that mental health is health. This is personal for me, and I want to tell you why. In 1998, Swiss Air Flight 111 crashed off Peggy's Cove in Nova Scotia. My Air Force squadron responded, as did the Navy, first responders and fishermen nearby. I saw how the exposure to trauma impacted some of my colleagues. It was the first time I heard the term operational stress injury, and I saw how the military was trying to treat mental health like physical health. We must get support to the people who need it. Since I left the military, I've tried to work to reduce stigma, find ways to help, and make wellness a priority. As Prime Minister, Rebecca and I will make this a personal mission for the recovery of our country. En 1998, le vol Swiss Air Flight 111 s'est écrasé au large de Peggy's Cove en Nouvelle-Écosse. J'ai vu comment le traumatisme a eu un impact sur certains de mes collègues. C'était la première fois que j'entendais le terme traumatisme lié au stress opérationnel. Et j'ai vu comment les forces armées ont essayé de traiter la santé mentale comme la santé physique. Nous devons apporter de l'aide aux personnes qui en ont besoin. Depuis que j'ai quitté l'armée, j'ai essayé de travailler pour réduire la stigmatisation, trouver des moyens d'aider et faire de la santé mentale une priorité. En tant que Premier ministre, Rebecca et moi allons faire de la santé mentale une mission personnelle pour l'avenir de notre pays. Our Canada Mental Health Action Plan will provide real help to those in need and their families. Notre pays doit reconnaître que la santé mentale est la santé. Notre plan va agir pour aider les gens qui ont besoin d'aide et leurs familles. Working together, we will build a mental health care system that meets the needs of all Canadians. Ensemble, on va agir pour l'avenir. Merci beaucoup. Thank you very much.
We will be taking questions. Nous allons maintenant prendre les questions. First question.
Hi, Mr. O'Toole. Chris Reynolds, Canadian Press. So you've pledged $60 billion more in funding for healthcare and mental health care to the provinces. But you also said this week that you will not direct the provinces as to how to spend those healthcare transfers. So it sounds nice to suggest that a big swath of that $60 billion is going to go toward mental health care, but will there be concrete conditions to ensure that it does?
There will be concrete commitment to the most historic funding for our public health system in a generation. I support a public and universal healthcare system, and that is why we're committing $60 billion over the next decade. We will partner with the provinces, not create confrontation as we've seen with Mr. Trudeau. And we need to make sure universal access, more choice and less waits are part of helping our country rebuild after COVID-19. Our front lines are tired. Canadians see a rise in mental health. We need to fix gaps in long-term care. I will partner with the provinces to help our country with that part of our recovery. On doit travailler ensemble, les provinces et le gouvernement fédéral. Notre système de santé public et universel est une force pour notre pays. C'est pourquoi je vais investir un autre 60 milliards de dollars au cours de la prochaine décennie dans notre système de santé publique. Je vais être là comme un partenaire avec les provinces pour nos premières lignes, pour notre système de santé, les CHSLD, les résidences pour aînés, et sur la santé mentale des Canadiens après la pandémie. On doit travailler ensemble pour le bien-être des Canadiens et des Québécois.
You've also pledged to reduce Canada's greenhouse gas emissions by 30% below 2005 levels by 2030. The current Liberal government's bar is set at 40 to 45% reduction. So I just wanted to confirm that a Conservative government would indeed lower the threshold for greenhouse gas reduction ahead of the UN climate change conference in November, and even as our allies are upping their reduction threshold.
In April, I launched an ambitious climate change plan that will meet our Paris targets, meet our obligations as a country, but have vastly better jobs and investment performance than Mr. Trudeau's ever-rising carbon tax. We've modeled our plan. I put it out to Canadians because the environment and climate change is important to me, not just as someone asking to be Prime Minister, but as a father of young children. And it's a costed, detailed plan. Mr. Trudeau has never made a target in his 6 years. So Canadians deserve a team with a plan. Canada's recovery plan will get our country moving in all sectors, and we will tackle reducing emissions as well.
Next question.
Hi, Mr. O'Toole. Kevin Gallagher, CTV National News. There has not been a Public Health of Canada press conference since the start of this election, modeling data from our National Public Health Agency. We haven't seen it. We're in a fourth wave. Do you think that they should be giving updates to Canadians, or is there a concern about having this type of information out there in an election? Could it influence it in some way?
We are in a fourth wave. We are seeing crisis in Afghanistan. We're seeing forest fires in British Columbia. We should not be in an election. We are only in an election because Mr. Trudeau is putting his political interests ahead of the national interest. And he should be transparent with respect to the decisions he took in deciding to cause this election. What we have done is we put forward Canada's recovery plan so that Canadians can choose a government that will be ahead of a crisis. Our fourth pillar will make sure we reinstate our pandemic early warning system, which Mr. Trudeau cancelled. We will make record investments in healthcare. We will be more prepared in the future for a crisis. Mr. Trudeau was not prepared, and now he's putting his own political interest ahead of the well-being of Canadians. It's unacceptable.
I just want to move on to Afghanistan. So, sir, you've said that I asked you before, that you would lead if you were in charge right now in terms of Canada's response. But you've also said that you've known about the dire situation, the potential for this type of collapse for 5 years. So I'm wondering, you've said you've talked about this behind the scenes, but we haven't heard anything in the House of Commons. There hasn't been a public pressure campaign on the government when there was still time to avoid what we're seeing unfold right now. Still a better option to get troops in there in a safer way and also in a less expensive way. Where has your leadership been to publicly pressure the government over the past 5 years that you've known about this impending crisis in Afghanistan?
The situation on the ground in Afghanistan is heartbreaking. We see the Taliban once again exerting its regime and will be suppressing rights, putting people at risk. And Mr. Trudeau has abandoned people there. He had 6 months to prepare with the withdrawal of American troops. He's had years to make sure that people are at risk because they serve Canada are taken out of the country. My efforts a few years ago were successful in securing one translator to come to Canada. Mr. Trudeau and his government ignored this problem for years, did not take action months ago when nonprofits, veterans organizations, and Canadians were demanding action. Mr. Trudeau put his political interests ahead of a crisis there. I will never abandon people that stood with Canada.
Next question.
Je vais toujours être là pour les personnes en risque, en danger à cause de leur appui pour notre pays. C'est totalement inacceptable. Et il y a 6 mois, M. Trudeau a eu rien après l'annonce du président Biden sur la situation en Afghanistan. Il y a 5 ans, j'ai demandé un programme d'aide pour les traducteurs, les travailleurs sur le terrain en Afghanistan. On doit être là pour les personnes en danger. C'est important pour notre pays. Et comme Premier ministre, je vais agir dans notre intérêt.
Next question.
Good morning, Marika Walsh with the Globe and Mail. You say that you would act if you were in government. So if you were Prime Minister now, we know that Afghans who worked for Canada's mission will be left behind given the time that we have remaining. If you were Prime Minister, what specifically would you do? Would you leave them there? Would you help them get to another country? What specifically would you do?
I would never abandon people as Mr. Trudeau has. He's lost 6 months, he's lost years to act. As Prime Minister, I would leverage our Royal Canadian Air Force and our Canadian Armed Forces. I know their capacity because I served in uniform. I would work with our allies to make sure that we can support those at risk, get them to safety, and support the overall security in the country and region alongside our allies. Canada's voice is needed on the world stage more than ever, and Mr. Trudeau is not a serious voice for Canada, for our interests, and for the people he's abandoning on the ground in Afghanistan. On doit agir pour les Afghans en danger maintenant. Comme Premier ministre, je vais agir. Je sais la capacité de nos forces armées canadiennes parce que je suis un ancien combattant moi-même. On doit agir en étroite collaboration avec nos alliés, d'aider les gens en danger et de régler la situation avec nos alliés en Afghanistan et dans la région.
The G7 has already tried to pressure the U.S. to stay longer. The U.S. is leaving. Canada's own forces do not have the capacity to hold the Kabul airport on their own. So again, what would you do for the people left behind specifically?
We would get them out. We can work with our allies. We have the capacity to provide support, to provide assistance, to gain intelligence. And I can't stress it enough. This is why, for months, nonprofits, veterans organizations, military organizations have been demanding action by the Trudeau government. We've been demanding action for months and years, in fact. Canadians deserve a Prime Minister that will always stand up for our interests around the world and will always have the back of people that are at risk because they helped Canada. I can't stress that enough. It's time for a serious leader who will be able to stand up for our interests and people who've served with us.
Next question.
Mr. O'Toole, Michael Couture from Global National. I'm just going to follow up on something my colleague asked you, and I just want a quite simple answer, and I'll try and ask it quite simply. Yes or no, should the Public Health Agency of Canada be giving regular updates during the election campaign on the pandemic?
Mr. Trudeau should not have called an election during the 4th wave of a pandemic. Has he silenced the Public Health Authority from giving public updates? That's a question for Mr. Trudeau. But without question, we should not be in a 4th wave pandemic or election. We should be working together to combat the Delta variant, supporting efforts from our front lines, supporting the provinces, not picking fights with them, and making sure we back up our healthcare system, which is tired after 16 months of fighting COVID-19. That's why I'm making historic investments in our public health care system, 6% minimum increase of federal transfers per year, representing $60 billion to help build up our capacity to make sure we're ready for health risks in the future. On doit travailler ensemble contre la variante Delta, contre la 4e vague de la pandémie. C'était totalement inapproprié pour M. Trudeau de déclencher une élection en pleine d'une pandémie. Et il doit parler sur les raisons, mais on doit travailler avec les provinces de lutter contre la COVID-19. C'est pourquoi j'ai annoncé un investissement historique dans notre système de santé, 60 milliards de dollars au cours de la prochaine décennie, d'aider les infirmières, des médecins. Et on doit être prêt dans le futur pour une crise, pour une autre pandémie. Et c'est pourquoi dans notre plan pour le rétablissement du Canada, on a un plan d'être prêt dans le futur.
Just as on another subject, in the last couple of days, you've made a few announcements that are clearly targeting unionized workers. So what do you say to unions who point to your voting record when you were part of the Harper government, saying that you voted against workers' rights, and now they're basically calling you a wolf in sheep's clothing?
I'm going to say to all Canadian workers, including members of unions, I'm going to fight for your jobs. I'm going to fight to make sure that I see upward pressure on wages. I'm going to fight against unfair hollowing out of our jobs with bad trade deals with China, allowing communist China to game the global trade system to our detriment. I will build bridges with unions, with nonprofit groups, with small business leaders to get this country back on its feet and start working again. Canada's recovery plan is our 5-pillar plan to have an economic recovery in all parts of the country and in all sectors of the economy. It's about jobs, it's about higher wages to fight the cost of living crisis under Mr. Trudeau, and working together for an economic recovery.
Prochaine question.
Oui, bonjour, Laurence Martin de Radio-Canada. Monsieur O'Toole, est-ce que vous pensez que le projet de 3e lien dans la région de Québec va ajouter de nouvelles voitures sur les routes?
Nous sommes le seul parti en faveur de le 3e lien. C'est un investissement important pour la grande région de la capitale, pour les travailleurs, pour les familles là-bas, mais aussi pour nos exportateurs, pour les entreprises. Et les Québécois et les Québécoises méritent une voix forte à Ottawa. Et M. Blanchet, il vient de changer sa position quelquefois. On va livrer le 3e lien en partenariat avec M. Legault, son gouvernement et les municipalités. On va agir pour le 3e lien.
J'aurais une deuxième question sur des commentaires faits par Mariam Monsef, donc ministre et candidate libérale à la prochaine élection. Elle s'est adressée dans un point de presse ce matin directement aux talibans en disant, et je cite, « Je veux saisir cette occasion pour m'adresser à nos frères, les talibans. Nous vous demandons de laisser tout individu entrer et sortir de façon sécuritaire de l'Afghanistan. » Qu'est-ce que vous pensez de cette expression « nos frères, les talibans » ?
Le gouvernement Trudeau a utilisé un langage totalement inacceptable. Après 6 mois d'inaction par le gouvernement Trudeau, il y a des milliers d'Afghans en danger à cause de leur soutien de notre pays. On a besoin de leadership, on a besoin d'un plan et on a besoin d'un premier ministre qui va agir dans nos intérêts, et je vais faire ça chez nous et sur la scène internationale. The language used by the Trudeau government is completely unacceptable. I think of the women and girls in Afghanistan are at risk with the Taliban regime once again coming into place. Canadians deserve a government that will always stand up for our values, for our interests, a Prime Minister who will act in our national interests at home and abroad. We're not going to get that with the Trudeau government. You will get it with the Canadian Conservatives.
Next question.
Evan Dyer, CBC News. The U.S. Centers for Disease Control reported yesterday that unvaccinated people are 5 times as likely to be infected with COVID-19, which of course affects others around them. We're seeing more private institutions and universities and so on adopting mandatory vaccination. Are you open to changing your position on that?
My position has not changed. Vaccines are the most critical tool in this pandemic. Every time I get to encourage people to take the vaccine, talk about how safe and effective they are for use to fight COVID-19, to stop the spread, I do so. That's why my wife and I were very public in our vaccination process. We also have tools like rapid tests that can be used on a daily basis. We have masking, sanitation, all the things we've done as a country, we have to continue to do. I will respect the personal health decisions of Canadians, and we can use rapid testing on a daily basis to make sure we all do our part to fight COVID-19. On doit travailler ensemble de lutter contre la COVID-19 et la 4e vague. Les vaccins sont très importants, un outil primordial, et nos vaccins sont sécuritaires et efficaces. Et j'encourage tous les Canadiens et Québécois de se faire vacciner. Je vais toujours respecter les décisions sur la santé des Canadiens, et on doit utiliser les tests de dépistage quotidiens, les masques et les autres mesures de travailler ensemble contre la COVID-19.
You said you would do more than the Liberal government to get people out of Afghanistan, and I want to ask you specifically about some of the kinds of operations you would be willing to consider, because of course there's risk involved. We've seen allies like Germany send helicopters out of the airport to bring people back. We've seen the French send vehicles out to bring people back. Would you be open to ordering Canadian forces, for example, to fly helicopters over Taliban-held territory? Would you be open to sending them to remote locations far from the airport to bring people back? Would you be open to sending them to evacuate or exfiltrate people from Afghanistan after the 31st of August without the Taliban's permission?
I have many friends from my time in the Canadian Armed Forces that have served in Afghanistan. They're devastated by Mr. Trudeau's complete absence of leadership, and I trust the Canadian Armed Forces to be able to conduct its operations professionally, to exert our interest. And our interest here is the fact that Mr. Trudeau has abandoned people that are at risk from the Taliban, a brutal regime, because they helped Canada. He's had months to act and has failed. As Prime Minister, I will never fail people who are at risk because they helped our country.
That's not an answer, Mr.
This will be the last question.
Answer the question specifically. Would you do those things? Would you send Canadian forces far beyond?
Having served in the Canadian Armed Forces, and let me repeat this, I trust the men and women to conduct operations in the highest order of safety and capability. We had months to act when it would have been much less of a risk to operate. I will work with our Canadian Armed Forces to make sure, alongside our allies, we provide support for people at risk. It's unacceptable that Mr. Trudeau wasted not just months, years. Canadians deserve leadership, and that's what they will get with a Conservative government.
This will be
Les Canadiens et les Québécois méritent un gouvernement prêt d'agir dans nos intérêts. Et j'ai beaucoup de confiance dans nos forces armées canadiennes, le plus professionnel au monde. Et j'ai servi à côté des Canadiens et Québécois extraordinaires en uniforme. J'ai beaucoup de confiance en leur capacité. Et c'est totalement inacceptable pour M. Trudeau d'oublier les gens, les Afghans sur le terrain, qui sont en danger à cause de leur travail avec nous. Les Canadiens méritent mieux.
This will be the last question. Ce sera la dernière question.
Sir, Vincent Ball from the Brantford Expositor. Welcome to Brantford, Brant. You've addressed addictions and you've addressed the mental health. I'm wondering if you could comment, sir, on what you would do or what, as Prime Minister, to help municipalities that are dealing with a very severe affordable housing and homelessness issue. In Brantford, we've got people putting in encampments in the downtown, in and around the downtown. It's something that's happened basically over the last couple of years. What would you do, sir, to help municipalities deal with that?
Well, I want to be a partner with all levels of government, municipal, with the provinces, and with nonprofit organizations, as I said, like Liberty for Youth, helping folks at risk. Some of our addiction strategy will help people. Many people that experience homelessness also are dealing with mental trauma and addiction. Our treatment beds will help accelerate that. 1,000 treatment beds and 50 community centres. We've also launched a very comprehensive housing policy to address the housing crisis. Mr. Trudeau has had 6 years of inaction. We will act. And of those measures, some of our dedicated provisions to encourage the building of more purpose-built rental housing. There is an absence of that in Brantford, Brant, in Southern Ontario, in all parts of this country. That's why with Canada's recovery plan, we have a plan to tackle the challenges facing our country. And we require a plan and we require leadership. We don't require division and misleading campaigns as we've seen from Mr. Trudeau.
Another important issue for Brantford Brant in recent times has been flooding, environmental concerns. We certainly don't have the problems that we're seeing out west right now with bushfires and so on and so forth, but there has been flooding and there has been climate change issues. Is there any plan from you to help cities manage that through infrastructure funding or any kind of programs to help municipalities deal with that?
Yes, there is. That's an important question because we see with the forest fires in British Columbia with increased flooding or in some cases drought, we're seeing climate change and its impacts right now. So we launched a very comprehensive climate change plan in April to meet our Paris targets, but also to get the country working again. There's also building resiliency and capacity where we can partner on infrastructure investments as the federal government partnering with the provinces and municipalities to build more resilient communities that will be facing the impacts of climate change. This will be the big difference between Mr. Trudeau and myself. I have a plan, I will deliver, and I will build partnerships. I won't divide people, I won't mislead people. We need to work together to build our economy, get people working, and tackle challenges from mental health to climate change. We have a plan to do that.
It will be all for today. Ce sera tout pour aujourd'hui. Merci. Thank you.
Thank you. Merci beaucoup.